We can all learn an awful lot from each other, but I really had a privilege this year moving through Spooner, and then I was also at Black River Falls. And Black River Falls, what really hits me when I went into Black River Falls, and both Spooner and Black River Falls were just so much fun. And so when I say this is because Black River Falls is our May winner of our organization of the month, was when I went into Black River Falls, when you go into the lobby, to the right is their cafeteria where you can, cafeteria. And if you've ever seen a Jumbotron scoreboard, that's what it reminded me of. They've got one whole wall when you walk into the left, which is their dashboard. That means everybody that walks into that hospital knows exactly how they're doing in service, quality, people, finance, and growth. And it reminded me so many years ago when I was at Holy Cross Hospital, and our patient satisfaction is what we called it back then. Today we call it perception of their care, was not good. And the measurement team, we had a measurement team, we just started, they wanted to put one of these thermometers up in the cafeteria. And they wanted to put we were like 14th percentile, and our goal was a 75th. You ever seen those United Way things where they fill up the thermometer? And so I'm sitting there, and they have this drawing of this giant thermometer they want to put up in the cafeteria to monitor our patient satisfaction. And they looked at me and said, "What do you think?" And I'm sitting there going, how can I stop this? The last thing we want is our family members to sit in a cafeteria saying, "My gosh, my mom's in a hospital in the 17th percentile." So I said, I don't think that's a good idea, because I don't think we want the families to know. And a nurse said, "They already know. What do you think's giving us the 17th percentile?" Please don't think I led on a lot of these things. Many things I've been breech-birthed on this baby. Sometimes it happens. I was telling a story at lunch or breakfast this morning that at Holy Cross Hospital we started to be more transparent. So we started sharing financials with everyone. Now I will tell you, it was an executive summary of financials. It wasn't into the little detail. So when I got to Baptist Hospital, I announced that we were going to share the financials with all the department leaders, because they had never seen them to the extent, just had seen a little bit. And then they would share them with employees. Now in the back of my mind, I was thinking I would create an executive summary like we used at Holy Cross. And all the CEOs know out there, when you learn this when you're brand new, is be careful what you say, because people take you literally. I mean, you have to be real careful what you say. You can't walk in and say, "Gee, that wallpaper looks a little loose." Next thing you know, you're getting a purchase order for this new wallpaper, and you say, "Who made this decision?" And you found out you mentioned the wallpaper down there. So you have to be a little bit careful of what you say. Well, anyway, I come to my office one day, and there's these boxes. And I said to my secretary, "What's in these boxes?" She said, "Well, it's a copy of our financials. All the leaders are coming and picking them up, because you said they were supposed to share the financials with the employees." Well, I picked up the financials, and I went to my office, and I mean, they were the financials. I mean, they had what we were paying consultants, now they didn't go into salaries, but they said what all our legal expenses were, everything. How am I going to explain this? Then I said, well, I guess I got to now. And it really made us helpful. So today we still do a lot of that at Student Group. Even though we're a privately owned company, we share our financials and we sort of work through there. Anyway, this is an organization that not only does great work in their own community, but they also reach out to other hospitals in Wisconsin. And they just really do a great example. They got results across all 5 pillars. Communication is their strong suit, and also beef jerky. You've never had better beef jerky in your life than if you go to this place. So I'd like to have Stan Gaynor come up from Black River Falls, and I'd like to give him the Organization of the Month for that.
I'm glad I didn't sleep in this morning. I'm also not too happy about having to follow Dennis, because everything Dennis said I can certainly say about our organization too. We've been in the community for a long, long time, and recently doubled the size of the hospital, gave us this nice facility that Quint was talking about, able to deliver more services to the community. The program, the student program, has done wonders for us as far as the culture of the organization, and as Dr. Katowski had mentioned, and he is not recruitable. He has really worked to move the medical staff and the hospital much, much closer together. We also have, I think, 19 of our fire starters here today, if they would please stand. So there are some of the people that help drive the culture and the quality of care in our organization. Very proud of every one of them. Included in the group that stood are also 3 board members, which sometimes can be a little bit more difficult for board members and medical staff members to get away. But we're all in this together. And you had mentioned earlier that we're more alike than not. And as I listened to what was said earlier, yeah, couldn't say exactly the same thing about Black River Memorial. But thank you very much for the award.
Thank you. The great part too about the network is people share. One of the great advantages about healthcare is people give it away.